Good afternoon, everyone. My name is Kang Yi, and also my amazing teammates, Elaine, who will talk about the unfair cost of womanhood, Joanne, who will offer us the solution, which is reschooling, and also Yen Fen, who will help us to imagine the future we choose. Now, let's start by watching a video. Now, let's start with a simple question. How many of you have ever had a conversation with a friend or family member about pregnancy? Now, how many of you have heard about someone say, "I'm so glad that pregnancy isn't going to cost me extra money," or worse, denied coverage? I'm guessing most of you probably didn't raise your hands, right? Because here's a shocking truth. For millions of women, pregnancy is actually seen as a risk in the eyes of the insurance company. And guess what? It comes with a cost, not only in healthcare expenses, but also in health insurance premium. Imagine this, a young woman starting her career, applying for health insurance. She's told, simply because she is pregnant, her premiums will go up. Or worse, she'll be denied coverage. All of this just for expecting a child. She's not sick, she's not injured, but just starting a family. Does that seem fair to you? Pregnancy should be supported, not penalized. However, in many insurance systems, pregnancy is treated like a risk. It's not just unfair, it's harmful. But here's the good news. We can change this. Together, we can create a future where pregnancy is being supported, not feared or penalized. Hence, we are here to show you how we can make this happen, but more importantly, how you can be part of us. Let's start by understanding the problem. We would like to proceed to talk with Elaine.
Thank you, Joey. And now, let's talk about the problem. Across many countries and regions, especially those with private health insurance system, pregnancy is often labeled as a pre-existing condition. Imagine that two persons at age 30 are applying for health insurance. One man and one woman. Both of them have the same health condition and lifestyle. However, the woman is charged more, and the reason is just because that she might become a mother one day. This is not just a speculation. Historically, women have charged higher premium due to maternity-related health assumptions, even when they are not pregnant. And this happens here in Malaysia. As we can see from the insurance website, women at childbearing age usually pay more for health insurance than men. And this pricing gap happens across major insurers such as AIA, Chubb, and Hong Leong. And for those who are already pregnant, things get worse. In Malaysia, maternity rider is not included in the standard health plans. This means that women need to buy for a separate rider to get pregnancy-related coverage. This means that they need to buy for the rider before 1 year, and they can get the benefits. This is because that the maternity rider is really expensive, and it usually comes with a 12-month waiting period. So even a woman buy the rider today, she must wait for a year before she can use it for maternity benefits. If she becomes pregnant during this period, her pregnancy won't be covered. Without insurance, many women face unexpected medical costs. They need to pay for the expensive prenatal care out of their own pocket, and this really creates a heavy financial burden. Also, some may just skip critical checkup just to save money, risking their own health and their baby's well-being. And all of this happens just because that they choose to have a child. This is not just a pricing issue, this is a fairness issue. Think about that for a second. Pregnancy is not a disease, it's a natural part of human life. However, our system treats it as a financial liability, as if choosing to have a child is a risky financial decision. This tells us a message that pregnancy is a risk. But A woman should never be financially penalized because of having biological ability to carry life. And this problem does not only affect someone who are already pregnant. You might think, I'm still a student and this will not affect me yet. But think about your future. Think about your partner, your sister, your friends, or even your future child. When they need care the most during pregnancy, the system is telling them that they don't deserve support. Pregnancy is not a luxury, it's a human right. And our system needs to have a change. As actual students, we have a responsibility to identify the unfairness in the insurance system. And we need to help develop solutions which can balance both risk and fairness. So, what can we do now to fix it? Joanne will now show us the solution.
Thank you, Elaine. From the needs, we can see that in many health insurance systems, women, especially those of childbearing age, are more often charged higher insurance premium, not because they are sick, not because they take more risk, but simply because they might become pregnant. Although pregnancy is predictable, it is also essential. Society benefits from childbirth. It should not be treated as a personal burden, but a shared responsibility. So, how can we fix this unfair system? The solution lies in the core principles of insurance itself, risk pooling. Risk pooling is a basic idea used in managing risk. It means combining the risk of many people into one shared pool. By sharing the risk, the cost can be spread out, making it more affordable for everyone. For example, insurance companies use risk pooling to spread out the cost across a wide customer base. In health insurance, having more people in the pool makes it easier to offer lower premiums and better coverage. This solution has already existed in the Affordable Care Act (ACA) of the United States, which is a comprehensive healthcare reform signed into law by President Barack Obama. The Act created a health insurance marketplace, which banned gender-based pricing and prohibited health insurance companies from denying coverage due to pre-existing conditions. Besides, it also requires all ACA-compliant health insurance plans to cover specific essential health benefits, including maternity care, which used to be an optional add-on that requires extra premiums. Now, we can see from the graph, in 2018, after the ACA was implemented, the percentage of uninsured women dropped significantly. This shows that the ACA have effectively dropped the premium of the woman, making it more affordable and fair. As a result, women are more willing to get insured and it is more worthwhile. In addition, from the government data, over 21 million of American citizens selected a coverage plan through the ACA marketplace. This shows that when pregnancy is treated as a shared responsibility, women are more willing and able to get insured. So, risk pooling is not just a nice idea, it works. Therefore, a new risk pooling policy should be applied. We need a health insurance system that uses risk pooling to include maternity and newborn care as a standard benefits, not as expensive add-ons, not as extra costs, but as part of the shared coverage we all contribute to. Because society benefits from healthy mothers and babies. It saves life, it saves money, and it strengthens equality. Now, we have seen what a fair solutions look like. Let's take a step further. What kind of future are we heading towards if we act or if we don't? Yen Fen will help us visualize that.
Thank you, Joanne. Now, close your eyes for a moment and picture a healthcare system that truly values life. A system where pregnancy isn't treated as a financial burden, but as a shared responsibility, which is a fundamental human right. Where every woman, no matter her income or background, has universal access to comprehensive maternity care. Prenatal visit, safe delivery, postpartum support, all covered without exemptions. No more family pushed into debt by medical bill. No more women penalized simply because their body can bring life into the world. This is the power of risk pooling. Instead of forcing women to bear the cost alone, we all contribute, men and women alike. Because the maternal health is a collective priority, not an individual risk. Insurance companies no longer to charge women more for the basic biology. We know that that means no more loopholes, no more fight for coverage, just dignity, fairness, and freedom to start a family without fear. And the ripple effect, gender bias in the relic, become the relic of the past. A woman have a power to have children on their own terms. Mothers and babies are healthier. Family thrive, businesses benefit from stable and productive employees. Government save billions by preventing costly emergency care. This is what happens when we value motherhood as the public goods it is. Now, because today we are still stuck in the world that punishes women for pregnancy without risk pooling, we know that the financial burdens only grow. Women remain at a structural disadvantage simply because they can give birth. Low-income women and women of color suffer most, denied care, priced out of coverage, left to face the dangerous pregnancy alone. Maternal health disparity widen. Families are forced to choose between medical bill and putting food on the table. If we don't aid, we are telling women, your biology is a liability and your health is a privilege. That's not just unfair, it's unsustainable. But we have the tools to fix this. Risk pooling isn't radical, it's rational choice. We can know that our future is clear, where women can get the care she deserves, where no family is bankrupt by birth, and where we finally recognize all supporting life isn't optional, it's essential. We have imagined it, let's demand it. The time for change is now. Now that we have seen the future we want and the future we avoid, it's time to ask, what can you do starting today? Back to you, Kang Yi.
Thank you, Yen Fen. Thank you to my amazing teammates for explaining to us how we can make this happen. But here's where you come in, because we can't do this without you. Now, I'm asking you to take an immediate action with us. We are going to start a hashtag campaign that will raise awareness and demand fair treatment for pregnant women under health insurance system. And all you need is just a few taps on your screen. First, open your favorite social media app. Now, post a message on your social media account. It can be simple, something like, pregnancy should be supported, not penalized. Time for fair health insurance. Hashtag, pregnancy is not a risk. Remember to include the hashtag, pregnancy is not a risk. Then, tag your local insurance provider. Let them know about you care about these issues and expect change. And we're not stopping here. Tag 2 friends in your post and challenge them to do the same. Because the more we involve, the louder our voice will become. When we speak together, people in power have to listen. This generation has a tool, the voice and the heart to fight for justice. And today, we are doing just that. So, post it, share it, stand for it. Because pregnancy is not a risk, it's a gift. And it's time for our health insurance system reflected that. Thank you for being here today, for listening, and for being part of the movement. Let's take action today and start making a real change. Together.